Positioning for the right-handed operator. After you have viewed videos for both anterior and posterior on the point resources applicable to your dominant hand, you should have an understanding of clock positions and surfaces away and toward. This video will serve to supplement that information with demonstration and more specific information to help your instrumentation to be more effective. Following the sequence in the flow chart located in the Neal book will allow you to proceed in a logical, time-efficient manner. Me, my patient, my equipment, my non-dominant hand, my dominant hand, and the finger rest. In general, the right-handed operator will sit in a 9 o'clock straddle position to instrument posterior surfaces toward her or him. The operator's legs should be beside the chair and not under the headrest. The operator's torso should face straight ahead, not twisted to the side. The patient's mouth should be at the height of the operator's elbow. The chair back will be supine for the maxillary arch with the patient's chin raised. In Sextant 1 facial, the patient's head will be turned slightly away from the operator. The light should be at arm's length away, adjusted to be angled upward for the maxillary arch. The tray should also be kept within arm's reach. The mirror will be used to retract the cheek with the mirror facing toward the teeth. The mirror may also be used for illumination or retraction depending on which surfaces toward the operator are being instrumented. The non-dominant mirror hand should have a fulcrum, however, it may be extra or intraoral. Handle placement of the non-dominant hand will be towards you. Finally, the fulcrum finger of the dominant hand will be placed 2 to 3 teeth away from the tooth being instrumented. The fulcrum will be placed on the occlusal or incisal surface. This will provide maximum accessibility and visibility. Observe as she demonstrates on the facial of Sextant 1. This is a surface toward. The mirror is used for retraction and illumination. The mirror will be used for the entire sextant. Observe as she demonstrates on the lingual of Sextant 3. The patient's head is turned slightly away and the mirror is used for illumination. Generally, for surfaces away, the right-handed operator will sit at the 10 to 11 o'clock position. There is some flexibility here depending on the size of the patient and the operator. The mirror will be used for indirect vision or retraction depending on the particular surfaces being instrumented. Observe as she demonstrates on the lingual of Sextant 1. The patient's head is turned toward the operator. The mirror is used for indirect vision. Observe as she demonstrates on the facial of Sextant 3. The patient's head is turned toward and the mirror is used for illumination, indirect vision, and retraction. When instrumenting the mandibular arch, the patient's chair back should be raised slightly so that the chin can be tucked down. Operator positioning will be similar to the maxillary arch. Observe as she demonstrates on the facial of Sextant 4, which is a surface away. The mirror is used for retraction, indirect vision, and illumination. as she demonstrates on the facial of sextant 6. This is a surface toward. Observe the mirror being used for retraction and illumination. In the anterior, the right-handed operator will sit in the 8 o'clock position to instrument surfaces toward. In this position, knees will be pointed straight ahead with the back and neck straight. Surfaces away will be completed from the 11 to 12 o'clock straddle position. Observe how she has moved to the 11 to 12 o'clock position in order to maintain a neutral wrist position. In practice, sextant 2, surfaces away, both facial and lingual, will be done from the 11 to 12 o'clock position. In conclusion, mastery of the details of basic positioning will help you to build a foundation for successful periodontal instrumentation.